So thank you for being here today, everyone. We're going to talk about legislation needs of our community and maybe how that has changed this year with the COVID impact. But also we're open to talking about needs in general unrelated to COVID. We'll do some updates on our current bill priorities and where those stand for this session. And we'll talk a little bit about the process of you have an idea, you have a need, how does that turn into legislation? And we won't go into depth on that because there's like a lot of advocacy trainings that will, be 50 slides to take you through that process. But we'll talk about kind of like what helps you initiate it and kind of the first steps, your role as someone who may or may not be connected to legislators or the State House or even an agency. And then we'll definitely leave time for questions. But first, I want to welcome Charlie Fiske. Everybody, I think, on this call knows Charlie, and one of my absolute best friends in life. And I'm really lucky to work with him every day. And I would say at the State House, Charlie and I are a little bit like yin and yang because he's all about chatting and I'm all about content. We just kind of balance each other off. So also Charlie's had just incredible personal experiences that could take up 5 webinars or more, but we're gonna turn it over to you, Charlie, to give us a little background on kind of the success that you had when you had an idea that something isn't going right and there needs to be legislation to help, and anything else you want to share.
I also know, Maura, when I go into offices in the State House and you're not there, they go, "Where is she?" Which is it's a good thing, because what happens is we're able to kind of balance each other and get stuff done to push legislation forward. Let me just back up a little bit. My daughter, when she was 9 months old, needed a liver transplant, and back in 38 years ago, we had to take her to Minnesota. Blue Cross Blue Shield would not pay for it. And so what we realized how difficult we were, and there was nobody else. We looked around, there was no national system in place. And so we ended up reaching out to legislators and calling them endlessly for help, but we weren't sure what we wanted, and got a chance to speak to a group of American Academy of Pediatrics in November of that same year of 1982, and talked about the difficulty she faced needing a liver transplant. As it worked out, there was a young family in Alpine, Utah that saw that same national broadcast. 5 days later, their son was involved in a tragic car train accident, and they ended up donating their son's 11-month-old liver to Jamie, who survived and did extremely well. And I bring that up because it didn't stop there. We started getting calls from around the country because there was no national system in place, and we got into congressional hearings to basically take a look at, could there be a national system to match up organs across the country? And as a result, President Reagan signed a law in 1984 calling for a National Transplant Act to put a national system in place. That kind of pulled us into the legislative process because of the advocacy. And I think part of it is, I think all of us get pulled into situations because of those personal experiences. I think the difference is, what do you want to do with that? You just want to be able to go through it. And I think fortunately, in our case, we were able to reach out across the country to people to say, how do we make this system work? And that's kind of been the driving force in terms of how a lot of us get into these situations, because of a personal experience. And I think, fortunately, in our case, we had a lot of co-conspirators to move the national system forward, so that organ transplantation now is more routine than it's ever been. And people who were dying between needing a heart or a liver or a kidney are now able to survive. That's how I got involved in that whole kind of thing. And so I think part of it, for me, when you're 15 years old and your family said, "Oh, you can't do that because either you're too young or it's not been done before or you're just going to fail." Part of me never got over that. And I've always feel I've taken the word no and kind of taken that out of my vocabulary. So if somebody says it can't be done, I will do it just because I think I can do it. And I think I think that's what drives a lot of us to just move forward and say, look, this is an impossible situation, but I want to keep going forward. That's a little bit of the background. And it backs into the legislative piece, because a lot of the same stuff we ended up doing with Jamie, we used in a number of political kind of situations over the years with that same level of, I think this can be done. There's something that's not in place. How do we make the system better and work not only for ourselves, but for everybody? So that's the long and the short of it.
Yeah. Well, thank you, Charlie. Last week, we actually heard from Paul, whose son is Dana, from Dana's Law, and he mentioned that pushing forward for legislation was actually an incredibly important way for him to cope and to move on from the trauma of the situation. And I think that's true for a lot of us too, knowing that we can make a difference, whether it's gonna affect our own situation or not. It somehow helps you move forward and helps you cope and kind of put things in perspective. So I think a lot of us have that going for us. And
one of the things that's hard though, and I think other people will see, when you're first involved in it, you really feel you're all alone. I'm the only one going through this kind of situation, and you feel extremely, extremely isolated. And it's just difficult to keep going in the midst of situations that sometimes are just really overwhelming when hope is not that visible.
And that's, Charlie, that's really why the ARC is here, and that's definitely what we're trying to do, is bring people together.
Right.
And find those small coalitions of people who have the same need and bring that forward. So why don't we move on, and because we want to hear from everybody, but let's just get to a quick update, because I know people are wondering, they really want to follow the status of Nikkis Law, Dana's Law. So I just want to give you a little update since last week. In case you weren't here last week, just to give you the recap, the DPPC had proposed a delay in the implementation of the registry. And some of the reasons for that was the budget was released in January. The bill was signed in March, and so the budget did not contain the DPPC funding for the registry. Although the House Senate Ways and Means, they were prepared to put that money in the budget. Their actual budget was never released. So it made a lot of sense that DPPC needed to stand up and say, hey, where's our money? How can we move forward? And they did. We wished that they had stood up sooner so everybody could have helped, but there was just so much going on with COVID and kind of getting through day to day with these agencies. But that said, there could be significant delay because of COVID and the impact that it's had on all of our agencies across Massachusetts and the nation. But in terms of your outreach and the ARC's outreach and the DLC's outreach and a lot of other people, the governor and the secretary, Mary Lou Sutters, actually responded with a very strong commitment to funds and to the implementation of the registry. However, we want to make sure that DPPC has actually received those funds, and so we're still waiting on that confirmation. And the sooner they get them, the better, the more they can move forward in hiring and get this up and running. But we do feel really strongly that the administration is behind this. Stay tuned, and probably delays are inevitable because of where the starting point we're at. Also, the DPPC has confirmed their interest and their willingness to participate in an implementation committee, which will be headed up by children, families, and persons with disabilities, and we'll have a really good stakeholder group on there. So stay tuned for more on that. So that's Nikkis Law, Dana's Law update, and we can answer some questions on that later if people are wondering. But I did want to tell you a little bit about some of the other bills we've talked about over the last few months here on my webinar. The police training bill. So I think everybody remembers that we had a bill relative to training police in best practices when dealing with persons with autism or other intellectual and developmental disabilities. And when the police reform bill went through the legislature in a very quick manner a few months back, we were able to get our amazing champion on the representative side to file an amendment. And basically it is our bill that was filed to amend the police reform bill, and the amendment was accepted. And so our language is now in that police reform bill. I heard yesterday that the amendment is still very solid. We did some checking up. We had some people call, some constituents of the conference committee members called, and we also heard directly from the sponsor that Amendment 23 looks okay. So what we're waiting for now is conference committee to finalize and release this bill to the governor. But if and when they do that, which I also read in State House News this week that the governor is pushing for that conference committee to finish up with that bill. So hopefully that means we're going to see that soon, and we can celebrate the fact that we will have a mandated police training, and we can start working on implementation issues there as well. So, and that's just the beginning. Like many of these pieces of legislation, they're a beginning, and we still have a lot more to go to expand them to where we really need, including the registry. We want that to be much expanded in the future, as well as police training, which now covers the cadets and the corrections officers, but we want it to be out there for police that are existing and part of their existing training. So the ADU bill, so the accessory dwelling unit, I know a lot of people have been just working really hard writing their legislators, doing everything that we suggest around angling it to different committees. And we really thought with this incredible impact that COVID-19 had on congregate care settings, that it was the perfect opportunity to say, families who want to have their loved one, whether it's someone who would have been in a nursing home or someone that would be in a group home, but if they had space in their family home, they could make it work. This makes more sense than ever, obviously. If more people were not in these congregate settings, you know, potentially many, many lives would have been saved that were in these nursing home settings and long-term care settings. So a housing bill that went through didn't go all the way through, didn't get passed, but during that process, we tried to get our accessory dwelling unit amendment attached to that bill. And the bad news that we heard, the discouraging news, was that once again, the Mass Municipalities Association blanketed their response by saying, you know, we don't want any legislation that wouldn't allow local control of building out these accessory dwelling units or any other multifamily homes. So this sort of circles us back to just where we were 2 sessions ago, worrying about the same thing. How do we get around MMA, Mass Municipality Association? But we're not giving up, considering what's at stake. We need more advocacy at a leadership level to combat this kind of overriding opposition. So once again, stay tuned on that, because we're going to reassess, re-strategize, and figure out our best effort. I don't think it will include hitting the legislature again, because they have been very responsive, and I know all of you who've reached out, your legislators are saying it makes perfect sense. It's not a cost to the state. As a matter of fact, it would be a cost savings. So somehow maybe we need this elevated, and if COVID couldn't do it, you know, but I think it's still a very, very important factor, bringing in what happens in a congregate setting when a pandemic hits. So, so we'll continue to work on that. And our healthcare bills and some of our other bills, including the ABA bill, will likely go into next year. Although I do think we have a really rough, obvious budget ahead of us for 21. But I do think some of these bills will have a bit of a springboard because they did have a COVID, there was an impact with COVID-19 that we can connect to these bills. And so we're hoping that some of our bills that probably won't get through, we don't know how long the session is going to last this year, that at least they will have a leg up going forward. And there's one more bill that we still have hope for just going straight through on its own, and that's the higher education bill, the Macy bill. So Charlie, do you think that's all of our kind of priorities that were at play?
I think so. I think when we started out at the beginning of the session, we picked out 15 or 16 bills. I think one of the things we have to kind of realize that sometimes it takes 7 or 8 years for a bill to get through. So we'll be starting again in January to take a look at some of the things that kind of get pushed by the wayside and just kind of not starting over again, but just coming at it and refiling those particular pieces of legislation. And we won't know until the session ends what things have survived.
Yeah, we can plan a little bit though, and that's kind of what we're doing today is
right.
What bills have a leg up going forward, what's worth our time, effort, and advocacy, and what things have come up now, you know, through either this horrendous situation we're all living in, that's really brought to the surface the need, or you know, something that is something we can envision for the future that we should start working on now. So before we go into kind of what happens once you decide, yes, let's move forward with a bill, let's just see, you know, if anybody has any questions, if anybody has any thoughts for bills that they've been thinking about either pre-COVID or during this period. I'd love you to just unmute. There's only 14 of us here, so.
Hi, sorry, this is my first time attending this meeting. I'm the student of a school of social work in Boston University, and I'm just exploring a macro level what is like a policy taken through. And I'm sorry if I ask a question that sounds like I'm behind on this. And thank you. Disability is very important. So what exactly is ABA bill?
Okay, sorry. Yeah, so yeah, I'm usually used to our community of folks that know all my acronyms, and I'm so sorry that our ABA bill is probably not actually called an ABA bill, but it's Applied Behavior Analysis is the acronym for that. And the bill that we had been pushing, and I see Nan Leonard is on here too, and she can speak to it as well, was really for adults with autism, intellectual and developmental disabilities to get coverage from Mass Health for this type of service or therapy. It's a very important type of intervention, and currently Mass Health doesn't pay for adults to get this intervention, even when a doctor prescribes it, recommends it. So that's that bill.
I have to make a comment because I really disagree on that type of therapy. It's good to have a medical service provided for autistic people, but ABA and ABBA, I have autistic friends and they all told me that they had a pretty traumatic experience with the ABBA experience.
So Casey, we're not actually going to be debating the bills themselves today.
Okay.
But also I think that, you know, the spectrum is extremely wide, and there are people that benefit and actually really need it for safety. So I'm happy to have your opinion on some of the folks that you know, but you do have to remember it's a very, very broad spectrum.
That's very true.
Yeah.
Well, I'm open to it. I just want a clarification on the ABBA, and I'm very open to what you had to say about it. Thank you for this
Absolutely. I
opportunity.
can even send you some information on the bill later. And of course, it is prescribed by a doctor. And, you know, if your doctor, psychiatrist or psychologist is not thinking it's appropriate, obviously you're not going to get it prescribed. So that's important.
Can I put your emails in the chat, or is your?
I have your email if you registered, so I can send it out to you.
Thank you.
Okay. All right. Anybody else want to jump in on, you know, legislation ideas or any of our past legislation they feel strongly about?
So Maura, this is Mike Malone. Hello, hello. So last year, the ARC and the trade organizations really coalesced about the direct support workforce. And given that our staff are essential workers, given that we're paying people premium when they have to quarantine, we've had 70 infections here at HMEA. I know the Providers Council has been trying to get a fair pay for equitable work bill through. Do you think there'll be any kind of effort on the part of the ARC or a combined effort, given all that's going on? I appreciate the agenda regarding families, regarding more individualized supports, but there is that ongoing workforce issue.
Yeah, I mean, for sure, we're still working on the workforce issue. I think, especially through the budget, because we're not 100% sure of the Chapter 257 funds that were supposedly allocated at the beginning of the, well, in the governor's budget. So that's still on our maintain the budget request, and we're still working towards a bill that will increase the rate. It feels like now we need to have a bill that not only increases the rate, but provides even higher rates of pay for those who are working with COVID positive. And so that bill certainly should stay alive. We should be working with our sponsors on that to really add language to make it stronger.
Okay, thanks.
Yeah.
Just one comment. The last couple of days, I've been on Zoom calls with regional directors and thinking out a little bit. COVID is going to be with us for a long time. You know, probably a year according to the CDC, right? And then economic recovery is going to take a while longer. I've heard of at least 3 day habs that are closing. And I imagine that there are 10,000 people in day hab. And I imagine that thinking more long-term, this is just to get this on the radar about a scenario where maybe half the day habs close or something like that. So it's just a warning shot. We're thinking about today in the next few months, but long-term it's pretty dark.
Absolutely. Yeah, it's pretty frightening what's happening in the day habs. And I know that, you know, DDS is starting to work with the Providers Council, with ADDP, with the ARC, with groups of families on kind of how do we re-envision day services. So maybe this is an opportunity for legislation, or when we go back to my slides, you know, I was going to talk about the fact that sometimes you need legislation, but sometimes you need to work through an issue with the agencies in charge. And so some of these things may be able to be worked out without legislation. And some of them are so time sensitive that, you know, they need policy changes, you know, really quickly. So yeah, all that needs to get sorted out as we move forward and try to figure out the impact on day services.
Thank you.
Anybody else? Anybody else want to talk about need?
Hi.
Or
Hi, Tracy Graham here. Thank you so much for hosting. I just found out about your seminar through Mass Commission for the Blind, sent out an email.
Oh, great.
Yeah, and I have one child that's severely autistic and blind, and he's currently in Bradley Hospital since COVID started. I last year was in MFOFC, Mass Families Organizing for Change, and we went down to the State House and pushed a couple of bills that we thought were important. And it was the two that you're talking about, the police training, the autism bill, and then the ADA bill, which I didn't know until Charlie said it, that takes 7 to 8 years to put a bill in. So this would be perfect because my son is 7 for me to help push that. And I'm wondering, what can I do as a mom? I'm not part of any organization, but I've had advocacy training and all that. And I just want to help.
Absolutely. Oh, thank you so much for joining us. And I think, Charlie, you were speaking kind of on the average, right? Like some bills, you might get them passed in the first session. Other bills, take multiple sessions, and some will never get through. How many bills did we have filed this year, Charlie?
There was about 5,500 bills that were filed. In this, the bills are filed for 2 years. So at the end of this legislative session, starting 2021, there'll be a whole pile of bills that'll be filed. Usually it's more than 5,000 bills per year that are filed. This is as strange as it may seem. There's only one bill in the last number of years that went through the State House and into the governor's desk like lightning. And if you remember back a few years ago, there was a problem with people riding the MBTA doing upskirting photographs. And because of that, everybody said, we don't want that kind of person to be doing that kind of thing on public transportation. That bill went through without any objection at all. The others can go through maybe 2 years, sometimes 4, but a lot of times it's 8 years. And if you're talking about 5,000 plus bills, that's an awful lot of ideas that are out there. So I think part of it is the ability to realize things don't happen quickly sometimes, even if it's the right kind of thing and it's got merit to help people. It's just very, very slow sometimes. That's all.
For example, Tyler, remember the text and driving bill?
Yes.
Everybody thought, like, who would ever oppose that bill?
Right.
It's so important for safety. And then I remember you spoke with the legislator who opposed it.
Right.
And do you remember what he said, why he opposed it?
Yeah, he did. He was one of, on the House side, there were 160 members. 2 people were against it. And I was at a legislative forum with him, and I said to him, you voted against it? And he said, yes. And I said, well, and he's a bright guy. So I said, well, why? He said, I did my homework and I went to the National Transportation Safety Board, and the data shows that not only holding the phone in your hand or doing it with the Bluetooth, you're distracted when you're driving. And as a result, there's very little disparity between holding the phone and doing a Bluetooth. You're very distracted with driving. And I looked right at him and I said, Peter, I said, when I was coming out to visit with you in Southbridge, I missed the exit to Southbridge on the Mass Pike, and I had to drive an additional 12 miles to go up and turn around and come back because I was on the phone. So I think it's always important to listen what the opposition is.
Yeah. Sorry, I thought that the feedback that you got was that not everyone, that it wasn't kind of a fair bill because not everyone's car can go to Bluetooth, and that there were some socioeconomic concerns about like finding people whose cars couldn't really come up to speed fast enough. But anyway, I was just saying it because you never know. There's people that are gonna jump in and oppose a bill that seems like the registry, seems like a no-brainer. We talked about that last week. But since we're kind of running through quick here, I'm gonna share the slide one more time so we can talk a little bit through kind of some steps that we think are important. Where is your current slide? And again, this is by no means, this is not a training. This is just us kind of talking through. And like I said earlier, sometimes this advocacy work that needs to get done needs to be done directly with Mass Health or with DDS or with agencies. And then some, needs to be brought to the legislature, or both. Both needs to happen at the same time. And I think everyone's mind is on what has COVID-19 brought to the surface that must change. And I think, Mike hit it on the nail with day programming and the threats that's out there for that, for those programs. But Charlie, do you want to talk a little bit about, how to kind of prepare if you do have an idea or a bill that you'd like to move forward on?
I think it probably starts with the situation, whoever you are facing, that you can frame it in such a way that it's concise, it's direct, and you think this is a need that would be helpful to you and maybe to other people. And I think one of the things is looking around to see has anybody else been involved in this kind of activity? Is it the ARC or any of the other organizations that would be championing these particular kinds of things? And I think part of it is to framing it in such a way that you can say, okay, I can go to DDS and maybe get this done, or I can look around with advocacy groups, or maybe I have to come through the legislative process. And no matter what that particular situation is, and I think probably getting the feeling that you're not alone in the situation, and you're looking around to who else is affected by this particular situation. One of the ways is, again, coming back to the legislature. And I think part of it gets down to personal relationships, reaching out to knowing who the players are, who is your state senator, who is your state representative, and not only knowing that person, but also who works for these people, their particular aides. And I think part of it is your ability to use those people in an effective way to find out maybe there is legislation out there that would address this particular thing, or taking a look at why it's not there and begin striking that kind of relationship and trying to frame it in a way that it really makes sense if it has to come through the legislative process. Because again, you're talking about sometimes legislation taking a number of years to have happen. And it's sometimes, I think, your ability to be persistent, to be focused, look around for support and develop support is probably the first place to begin, I think.
Yeah, Charlie, I would jump in there to say, you know, it's so good, obviously, to get to know your legislator and tell them your story, your personal story, your family story. And, you know, they may not be a disability champion right now, but maybe a really great way to make that happen is to find 2 or 3 other family members in their district and set up a meeting. And I will tell you, if your senator or representative has a meeting with you and 3 other family members from his or her district, and you all have issues relative to disabilities, you're going to see that shift pretty quickly. I mean, it really does. We notice it takes like maybe 3, 4, 5, 6 calls, and they're starting to notice this is a problem in my district. This is something I should be interested in. So definitely power in numbers. Doesn't have to be huge numbers, but if this legislator knows that these issues are critically important to you and others in his district, her district, you're going to see them do some work for you. So there's a way to build a champion if there's not one there. And there's also champions out there that exist, and it might be your senator or rep already. It's really helpful if that senator or rep is a chair or a co-chair of a committee. We look for people that have what Charlie calls juice, people who can move things, who know how to work with leadership and have a good relationship with leadership. So all of those things make a big difference in the end, and will help you get more co-sponsors for your bill. And then if your legislator, your rep, or your senator, you know, just doesn't feel like they're going to do it for you, it doesn't mean that person has to file your bill. That person doesn't have to be your sponsor. You can find someone else who is a champion, who does want this to happen. You know, not necessarily your district.
I think one of the things, Maura, that comes through, and you and I have run into it before, sometimes with elected officials is a tendency to say, oh, I'll do this and I'll do that. I think part of our responsibility is to be very specific with the legislator or their ASIC. How can you help me? Get it to be very concrete, and not just to have them say, oh, I'll help you. How can you help me? And if that particular person can't, can they point you in a direction of somebody that could? So that you're not just walking away figuring, oh, they really listened attentively. That's important that they did, but you also want to know what they can do. And if they can't do something, I think it's important to understand that kind of from the beginning, and you're not expecting them to do something that they can't do.
Exactly. Yeah, so really on this slide, just some tips around, you know, if you do want to move forward with legislation, definitely find the agencies that, you know, care about the same things, connect with them, connect with the ARC if it's something disability related. So building your community, getting letters of support, doing that research like Charlie mentioned. If there's already some federal work being done on a similar issue, pull that in. If other states have already passed legislation, definitely pull that in. Google is your friend to find that information. And know a little bit more about the efficacy of what you're proposing and the cost. You don't have to have a complete budget, but really understanding what this means in terms of cost or cost savings, or however you can present it.
The other thing that happens too, Maura, and we've seen this, is that most of us have a very short attention span, myself included. And I think when we're presenting something, we have a tendency to want to go on and on and on. And the person we're talking with, sometimes their eyes are glazing over. I think it's important we kind of try to narrow down what it is that we're saying, that we can kind of communicate it very succinctly within a minute or 2 minutes. Anything beyond that, sometimes it gets lost. And I
Great
think
timing there, Charlie. Yep. So I was just going to say one thing. I've been working with an advocate recently who just has just a world of issues for her community, and we just said this is not this is an accessory dwelling unit, but we, you know, in our talking, I realized, gosh, you gotta narrow these down. We need a fact sheet. We need bullets, because your legislator is not gonna be able to comprehend a world of issues. So the best thing you can do, you know, is really get it concise, like Charlie was saying. Concise on testimony and telling your story and having that elevator speech is important. But a fact sheet that you can leave with your legislator that outlines the biggest issues is something to really work on. And we were, you know, we always do fact sheets for the ARC, but we were able to go back to our fact sheets this year and update them to show, you know, how COVID-19 has affected us and why that's even more important that we pass these bills now due to the COVID impact. So Charlie's right, just try to keeping it concise is huge.
the other thing, Maura, too, I think, and we sometimes miss it, we shouldn't be asking for something that the person can't do at the other end. For example, if I wanted to be, instead of being 5'8", I wanted to be 6'1", I could ask somebody to do that. That's just not going to happen. And I think we should realize that sometimes the things we're asking are not possible by that particular legislator because it's beyond the scope of their ability to do it. It might be a local issue, it might be a federal issue, but try to be realistic in terms of what we're asking. That sometimes things we think they can do and help us with, they just can't do it.
Yeah, or there's a lot of work ahead. You know, in particular, we're talking a lot this year about family being paid as caregivers. And, you know, we're hitting brick wall after brick wall on this. And a lot of this is an issue of bias. And bias takes a long time to work through. It takes decades to get through sometimes. And it's worth it, but you have to be ready to buckle up for the long haul. So you know, we're looking at PCA and AFC and how, especially during this COVID situation where, you know, parents are doing the work, but if you're the parent guardian, you know, you're not going to get supported for that. So working on that with a couple of really strong advocates, but knowing, you know, it's a long road, and breaking through that bias takes a lot of advocacy and a lot of people, but we're up for it.
The other thing too, Maura, that comes in our dealings with legislators especially, and everybody else, a lot of it comes down to relationships. Your ability to communicate with somebody, even if they disagree with you, to say, okay, there's a number of legislators that we have dealt with over the years, and we go at them a dozen times, and maybe on the 13th time or the 14th time, they say something clicks, and you're able to make that kind of communication with them. But I think part of it is, how do you develop that relationship with this particular person who could care less about your issue, but you know what, maybe tomorrow or the next day they have a constituent that will come in and raise that issue, and it is about relationships.
Just what I said too. I think the constituents getting together is pretty powerful. So
yeah.
Well, I want to let everybody go because it's we got 5 minutes, and if anyone has any additional questions. Also, we didn't really hear, you know, any specific ideas that people have, but we are totally open to your ideas, suggestions. Just stay in touch with us. The next couple of months, we're going to be looking at, you know, what's going to go on our platform and what makes the most sense. So anybody chat to me? Nope. All right. Nan, do you have something?
Yes, I'm sorry. I wasn't able to unmute before. But I did just want to, thank you for pointing out the importance of the ABA bill and how, that the importance of that bill has been really demonstrated through COVID, that unless you have you just can't get services unless there's a mass health right to get ABA for adults that could follow the individual and not be stuck in a building. And so we'd like to see if, even though Mass Health pays for it until 21, they'll start paying for it after 21. So thank you for raising that. But the other bill that I've heard people talk about a lot, especially in conjunction with Nikkis Law, is to push the videotaping. In the past, there's been a concern that allowing video in care settings is an invasion of privacy. And I think given the level of abuse, people are now coming around on that and seeing that the safety right might be more important than the privacy rights. And we need to start thinking about a bill that would allow video in congregate care settings.
Yeah, that actually came up last week a little bit as well, when Paul Joyce told his story about videotaping his son's room and catching the abuser that way. So yeah, I think all of these issues are going to play out, especially with the lack of oversight that has happened during COVID-19. There are less DDS checks, on-site checking. There's less people to report. There's less family able to get into the rooms and look at, their loved ones fully. So the risk is much higher right now because of COVID. So I know there's lots of concerns around it.
This is Lucy.
Definitely a good thing to think about. And there is currently a bill. Sorry, Lucy?
Yes. Paul, when talking, said he believed that the law prevented videotaping when there's voice, but without voice, it was not prohibited. And I guess that would be something very interesting for somebody to pursue within the laws and regulations to see if that's really true. On the other hand, Hillary Dunn from the Disability Law Center was really quite opposed to being able to videotape. So in some way, but videotape definitely would be something that would help all of us feel our children are secure and safe.
Yeah. Yeah, there was a bill last year and, a pretty heated hearing. It's definitely an issue with a lot of controversy, but, worth looking at as we move into the next session.
Thank you.
Thank you. Okay, thank you, everybody. Thanks for coming, and stay in touch and stay well.
Thank you,
Thank you,
Maura.
Charlie.
Thank you, Maura.